My name is Kate Lees. I'm a dietitian by training. I qualified in 1994, but I'm now working as a freelance consultant in public health, and that means I work as a consultant in public health in a couple of different local authorities. I also do some teaching. I'm also a moderator for the UK Public Health Practitioner Register and other project work that comes my way. The public health training scheme, basically you're called a public health registrar while you're on that scheme for 5 years. So it's like a job for 5 years. Everyone worries that it's training for 5 years, but actually it's just a job, a really exciting job for 5 years. And the first year of those 5 years is an MSc. So I just had an amazing time. I was paid my salary to go and do an MSc at the London School of Hygiene and Tropical Medicine. It was just wonderful. Amazing lectures. There was so much going on outside of lectures. You know, you could spend about a choice of about 3 different things every lunchtime and after college lectures. So it was really wonderful and such a privilege to be supported to do that. And then after that there was a series of different placements that I went through. One of the highlights of that period of training was a placement through the Wessex Improving Global Health Fellowship, and that took me to Cambodia for 3 months. So I worked for 3 months in Cambodia, which was just an amazing experience. So you go out there, as a clinician, but with whatever background, but go out there to do non-clinical work. And so, you have a project to get on with, and you find, the resources within you, and you learn so much about yourself professionally but also personally, and then you carry that throughout your career. So it was a really amazing experience. Since 2013 I worked as a public health consultant in a local authority for a few years, and then 2 years ago decided to take the plunge into freelance work. So that was really scary at first, because you think, am I going to get work? Am I not going to get work? What's going to happen? How will I keep my registration up? How do I work out the finances and the insurance and everything else? But actually it's been amazing. I've worked with NHS England, I've worked with Health Education England, I've worked with local authorities, I've worked with Improving Global Health, and in so many different areas, and it's just really exciting work, and I love the variety that it brings. So my ideal is not to completely work part-time, but actually I end up with a bit much work, but that's my choice, so that's fine. So yeah, it's great, and one day is never the same as another, so it's really lovely.